Welcome, everyone, to the La Cosmetic podcast. I'm your hostess, Monique Ramsey, and today I am joined by Dr. Luke Swistun. He's been on our podcast before. He's a plastic surgeon, and he's going to talk with all of you men in the audience about procedures that he has done himself and for procedures for men specifically, and sort of in honor of Father's Day. So welcome, Dr. Swistun.
Thanks so much, Monique, for having me.
So with Father's Day coming up, we just thought we'd get one of our dads. You're a father of 3, correct?
Correct.
And so I don't know how you balance that, actually. You're a busy surgeon. You have 3 kids, 3 boys.
Yes. I'm also married to somebody who is better at multitasking than I've ever met. She's a doctor herself, and she has a full doctor schedule. And somehow our 3 kids are still alive, and it's not because of me. She is absolutely amazing. But yeah, she I think she makes it possible.
Yeah, well, that's nice. But I think, don't discount yourself. But yes, you do have a pretty amazing wife. And
I hope
So, and your boys are how old now?
15, 9, and 4.5. Yeah, so it's very eclectic in my house.
I was going to say, so who's the handful at the moment? Or do you not want to say?
No. I mean, they all have their moments. I mean, it's very eclectic in the sense that, I'm teaching the 15-year-old how to drive stick shift, and then I'm trying to wean the 4.5-year-old off of the pacifier. And the one in the middle is picking up like his 5th instrument right now because he loves music. So he's actually quite good at it, where it's turning out. So each one has a different level of attention at different times of the day. But somehow it works out.
That's neat. Well, we're going to dive into some topics as we get going about, things that you've done over the years and things that are great for men. So get ready, everybody. So we'll start with you first, Dr. Swistun. So what have you done to yourself or for yourself over the years?
Well, I got to experiment a lot, obviously, because in training and residency, all the reps that offer product to the residents kind of give you a lot of free products so that you can learn and get hooked on their products, so to speak, but really get experience with fillers and Botox and so on and so forth, which really gives us an opportunity to get familiar with the techniques and frankly experiment. In general, my intent with everything I've done to myself is really to kind of like preserve what I used to look like before. So, and I think that's, in my experience at least, no one that I talk to ever wants to look dramatically different. Some people do, but most of the time the goal is to make them look like they looked 10 years ago, 20 years ago, whatever. Like when I looked like in high school, that's what I would like. And that kind of goes from head to toe. So I'm 47. There are certain things that happen sort of with age that are sort of inevitable. There are some things that you have control over, like if you can diet and exercise and stuff. And then there are some things that you can't control, like losing your hair, which sucks. No matter how many like push-ups and sit-ups I do, my hair doesn't come back. There are some things that change in the body that also you can't control. And one of them is basically there's fat that we lose, let's say from the face and from the rest of our body, that we sort of want to retain, that keeps us looking youthful. And that's usually on the face. It's the malar fat over here. It's some of the fat that we have over here, the temporal fat. Those are the features that kind of keep us youthful looking. And
let me just interject, because for the people who are listening, not watching, the malar fats, the cheek pads.
The cheeks.
Right. And then you were also kind of pointing to the jawline. Correct. And then the temples.
The temples, yeah.
Yeah.
There's, I could name many other areas, but in general, that's sort of the areas that sort of tend to atrophy and you lose volume there. And that's sort of what makes you look a little older. Everybody says that gravity took my face down and that's why I have wrinkles and everything's down. It's really the loss of the volume that allows the skin to redrape lower. It's not so much the gravity. So the treatment for that is really restoring that volume. And the simplest way to do it early on is just with fillers. So that's what I have done. There is a certain shadow that sort of starts creeping in, like across the middle of my cheek if I lose that volume. And first time I noticed it maybe about 10 years ago or so, and it took about 1 cc of filler to sort of restore that. It's filler that you put deep right on the bone, but it just sort of pops out the rest of your volume back to that original contour, and it works really well, and it's a pretty powerful intervention. And it's just one example, but you can do that in many different places. The pre-jowl sulcus, which is basically this area sort of between where the chin ends and where the side of the jawline and the cheek begins. A youthful jawline is very straight from the angle of the mandible, from the back of the mandible all the way to the tip of the chin. It's kind of a straight line. And as we get older, there are certain things that happen that make that straight line not straight. So you lose volume immediately behind the chin. You gain volume when the skin redrapes downwards. So little interventions to fix those things kind of restore that youthful jawline. So again, filler to that little divot, the little dip right behind the chin is a good idea. That sort of restores that jawline. And then a little bit of filler in the very end, like the angle of the mandible. That's something that I done recently with Con. That actually worked out really well. And
is that edge kind of closer to your ear? Is it that curve there?
Correct. It's that basically that angle right behind, angle of the jaw right under your ear. If you can define that.
And is that done with threads or with filler? Or
I did it with filler, but it can be done in a couple of different ways. I did not do threads yet. But I think the threads come into play when you have that redundant extra skin starting to kind of come down and giving you a jowl. I think the threads are able to sort of redrape that. Prior to that, I think filler sometimes can be enough. I think I'm getting to the thread part in the near future.
Are you?
As I'm getting older, yeah. So that's
then Botox. Tell me about, is Botox something that you partake in? Or?
Yeah. I mean, there's certain amounts of Botox that I occasionally can obtain. And, whenever I take it home, immediately my wife claims it. So, I don't get to do it a lot just because of that. She's like, oh, you don't need it. You're a guy. You look great. But in reality, yes, that's sort of the easiest intervention really to take you back 10 years. It's, Botox in all the right places, really restores, youth in the sense that it smooths out the skin. There's a lot of wrinkles that start to creep in, and as they form, if you get them early, your skin will remodel. Once the muscle underneath creating that wrinkle is paralyzed, your skin will remodel over that muscle and make it smooth again. And that permanent wrinkle can actually go away after about 6 weeks after Botox or so. And if you maintain that, then that wrinkle won't come back until you start animating again.
I actually noticed that in my late 20s, early 30s. I was always frowning and washing my hair. Didn't matter. It was like you concentrate and you do that. And since I've used Botox, I have other wrinkles, but that wrinkle, it really did sort of go away. So that's interesting that you said that.
Yeah. And I think there's some sort of unspoken alternative sort of benefits to Botox. I mean, I noticed that I frown a lot all the time, and it just kind of gives me a headache or like at the end of the day. And then when I have Botox, I don't have to even think about it, but I don't frown because I can't, because that muscle is paralyzed, but I tend to get less headaches.
Interesting.
It's a real effect. And obviously, tension component migraines are treated with Botox by neurologists all the time. But you don't necessarily have to be diagnosed with a tension component migraine to actually benefit from this to a certain extent, as I found out.
So you also, I remember last year, and we did a 3-part series podcast on, it was called I'm a Plastic Surgeon. I had HALO laser treatment, and here's what happened. So we'll put that in the show notes. And have you done that before, or was that your first time with the HALO?
That was my first time, actually. I had a chemical peel that I've done on myself, which was a very superficial treatment with an easy recovery. Again, just experimenting from what I've been able to obtain product-wise earlier.
Yeah.
But I think the HALO is a really good intervention. It's a deeper resurfacing modality than the peel that I did, and it definitely had a better effect. And it just kind of forces your skin to regenerate itself on the surface. And I think it's a really good way of just really, getting back the glow from a couple years back.
Yeah, yeah.
Very effective.
And is that something you would see yourself doing again, like on a schedule, or do you?
Absolutely. I think it should be something that is put on my schedule, and we should make time for it.
Right.
It's a challenge to do that, but yeah, it's interesting how we sort of ignore ourselves when we're in this, because it's almost sometimes we can say it's sort of immediately available to us, so we kind of put it off, and I end up like not having done anything for a very long time at this point.
And what was the first procedure you ever did? Was it Botox or a filler, or was it something else?
It was Botox, I think, was the very first, yes.
Yeah.
And then filler
and
after
I
that.
think that's sort of an easy entry for men. But let's get into some of the things that may be more surgical in nature, and you mentioned hair. So I know that we do PRP, which is platelet-rich plasma, which you can get from your own blood.
Correct.
And take those regenerative cells to help hair. Can you talk a little bit about that?
Yeah. I think it works. I definitely have done that. And there's pictures of before and after on one of my Instagram feeds from a long time ago where about 4 or 5 years ago, I noticed some pretty significant hair loss. And the way I presented is I got a sunburn one summer, but the top of my head was burned so much. And I was like, what is going on? Why is that? And that's how I discovered I lost hair. That's the very first, until then I didn't see the back of my hair, but then I felt it back there. I was like, why is my scalp sunburned? So that was about 5 years ago. And since then, I've gotten on a medication called Propecia. And I think that's sort of the best sort of mainstay to at least maintain or maybe regrow some of the hair. But anything you can add to that really works well. And for me, PRP worked really, really well. I don't know if it works for everyone. In general, when I do it for patients, I tell them that we should do 3 or 4 trials, about 6 weeks apart. And if you notice a significant difference after 3 or 4 months, then you are a good candidate for that and you will respond and it'll work. But if you don't notice a big difference, then it may not be the best modality for you. For me,
and that's just where you're injecting it in that area or the whole
Correct.
head, or
yeah, correct. So PRP is basically derived from your own blood. So we draw blood from the patient and then we spin it in the centrifuge and then we extract a specific layer called the platelet-rich plasma, which basically has platelets, which happen to have a lot of growth factors in them. And then we inject that specific layer at a higher concentration back underneath the scalp. And those growth factors from the platelets stimulate a lot of new tissue generation and sort of wake up the cells that are falling asleep right there, and specifically the hair cells. And again, it's made a big difference because I remember being on just the medication by mouth alone with not a significant effect. But once I added the PRP to it, it made a big difference. Those two combined for me made a big difference. I could almost get away with not having lost hair unless you look at it from the right angle, then you still see it. But
oh wow, that's a pretty big deal, and
it was
something that it's like an office visit, right? Like you can go out to dinner, and is there any long-term or short-term effects that for caring for your hair?
The procedure itself is fairly straightforward. Takes about an hour, and part of it is drawing your blood, which is pretty quick, and then you have to wait for the processing until it's ready to be injected. And then we just inject it into the scalp. Some people tolerate it better than others. There's lots of different modalities that we can do to make patients comfortable. There's nerve blocks and ice and numbing cream and a combination of all those things that we can do in advance so that the injection is pretty well tolerated. I've sort of gotten used to it, so I don't mind. Dr. Salazar did the last 2 or 3 of mine, and we just kind of went right ahead and did it.
And how often are you keeping up with that?
I should do it every 3 to 6 months. I think it's been at least that long at this point. So I got to put myself on the schedule again.
Again, it's putting yourself on the schedule. But I think that makes a lot of sense for men to actually think about this stuff, because time flies and all of a sudden it's a year and you're like, wait, how did that happen? Where if you actually just put a reminder in your calendar 4 months after the last one or 6 or whatever your intervention is, whether it's Botox or whether it's PRP or whatever you're looking at, HALO every year or 2, just put it in your calendar, because then you'll pay attention to it and get it done. So moving into kind of the surgical things, what do you think as a percentage, and I don't know if you can guess or not, but what percentage of men are doing cosmetic procedures overall, do you think?
I really don't know. Hard to say.
Okay.
I mean, I want to say, yeah.
I feel like it used to be about 15%, and
Okay.
but that was a long time ago, and it's much bigger now that there's non-surgical things and a lot of more surgical interventions. Like one of your big things is liposculpture and, kind of creating, take away the dad bod. Because I think we moms, we want our mommy makeovers after we have kids. And I'm not sure exactly how you guys have the dad bod when you don't have to carry the kids. It's just a cruel joke, right?
Yeah. Yeah.
But like, what is going on? Is it a hormonal thing where guys or is it that the fat descending or moving or shifting?
I think it's just a slowdown in metabolism. I mean, and especially for those men that had, not really had a problem maintaining a reasonable physique with a specific regimen of exercise and diet. They had put a reasonable amount of effort into it, and it worked for when they were in their 20s, 30s, and maybe 40s. But there's a sort of a point in time. It's different for everyone, but there's a sort of point in time where metabolism slows down, and then whatever you're doing that you're used to doing, if you do the same thing, it's just not going to cut it anymore. You're going to gain a little bit of weight, and it's usually in the places that you don't want it to be. And sometimes it's just a little, but it's just annoying because you're still working out, you're still eating right, but it's just doesn't go away. A lot of times the flanks and the lower belly is sort of the thing that collects. Like you lose your six-pack definition, you kind of gain a little bit of weight. For that, targeting specific areas is key, and I think local liposuction is sort of the best answer for that. That's not something I have done yet, but I'm like looking into it right now because there's this one area where it's like
for yourself.
It's just kind of on the back burner right now, but there's. I used to be pretty athletic in high school. I used to swim a lot and, maintain a reasonable regimen. And again, it's just, if you keep doing the same thing, it's just not enough. And there's certain areas that creep in, they just have zero control over unless you intervene on them directly. And I think the lower abdomen and the flanks is sort of one of those areas. Those are early on, and eventually other areas as well. And it depends, this is sort of an example for people who sort of maintain their weight. But yeah, aging just not fair, and you gain those areas anyway, even if your weight is maintained.
Yeah. So sort of reversing that dad bod, and you were talking about liposuction. So where do you where do guys typically what areas are they concerned with that you work on?
Yeah. So again, that would be the sort of the lower abdomen below the belly button tends to pooch out a little bit, and then the flanks, just the side of the trunk, that tends to gain a little bit of weight. So yeah, that would be the area I would target with liposuction. And then the other thing you could do is do some level of a little higher definition. If we're already there, it's easy to contour certain lines into the abdomen. It tends to work really well on men. I know Dr. Salazar does a lot of high definition lipo. That is a very good example of that. But even without high definition, you can do like liposuction with some conservative lines sort of on the side of the abs and in the center. I find that a big thing to have is like a midline. If you can have a midline shadow, that tends to really look athletic, even if you don't have like a six-pack definition or anything like that. So with simple liposuction, that's fairly simple to do. You can just add a couple of strokes and just go above the belly button and just create a midline shadow, and that really does wonders.
And how long would for a guy to be, if they have that kind of liposuction, what's their downtime?
Depends on the extent, but usually about, at 6 to 8 weeks out, pretty much everybody's healed and back to their normal routines. I think you have to modify your activity and routine for about 2 to 3 weeks. You have to wear a compression garment, ideally for about 3 weeks, 24 hours a day, and then for another 3 weeks, maybe when you're active. But that's about it. So, Yeah, not a
could they be back to,
significant.
I guess it depends on what they do for work. Like you could be, if
Correct.
you had a desk job, could you be back to work in a week or 5 days or 2 weeks or?
Yeah, a week or two is reasonable. Depends on how active you are. And again, depends on the level of intervention.
Right,
Yeah.
right. So if we're taking fat out, and I know for women, we've talked about this in the past. If you're removing fat from one place and putting it somewhere else, it seems like fat is like gold, right? So if we don't want to waste it, where do guys typically maybe want fat to go, or where do you recommend for them to use that fat?
Yeah, well, it's always the areas that you want to work out. So the simplest would be, the pectoral muscle area. If we can take away some fat from underneath the pectorals, like from the abdomen, and inject it into pectorals, then we're basically reversing that gravitational look, and that aged look, and we're really building up the chest and slimming down the abdomen. So that's the most obvious. But you can sort of use fat in many different places. You can augment the deltoids, the upper arms. There are surgeons, I don't do this specifically, but there are surgeons who actually specialize in augmenting certain specific muscles even.
Oh, wow.
And then
and what about
the fat.
Oh,
I'm sorry. And then the face is always an option also. Instead of filler, if you're already undergone a liposuction and the fat is right there in a syringe, it's available for you. Yes, I agree. I wouldn't waste it because this is a precious resource. You will only have so much of it in your lifetime. You can use it for fat grafting to the face and put it in the same areas that we talked about for the filler.
Mm-hmm. And if you're putting the fat in somewhere, is that a result that will last quite a while?
It should, yes. So the sort of how should I say this? The somewhat tricky part about fat grafting is it's a little bit unpredictable, and we don't know how much of it will survive. Some amount always survives, so there's always improvement in the goals. But some people retain fat better than others. It depends on where we graft and the quality of tissue that we graft into. It depends on the technique, which obviously we try to optimize. But in general, I would say 50% of the fat that is grafted will stay long term. And the 50% of it will sort of not revascularize, not regain blood flow, and it will basically melt away. But the fat that does revascularize, you keep for the rest of your life.
Oh, that's good to know.
Mm-hmm.
So on the liposuction side, when we talk about liposuction is permanent because those fat cells that you're extracting are gone, but what happens if you gain weight?
Yeah, so excellent point. So think of it this way. To some extent, this is true. Like you're born with all the fat cells you're ever going to have, and they are simply distributed in a certain way in your body. And when you gain weight, each one of those fat cells gets bigger. And when you lose weight, each one of the fat cells gets smaller. And so what we're doing with liposuction and fat grafting is we basically are changing the distribution of where they live inside of your body. So in general, when we liposuction, let's say the abdomen and the flanks, we are removing like 90% of the fat cells from those areas. And then when we fat graft somewhere, we are basically adding some fat cells to these other areas. So if you gain weight in the future, you will gain proportionately less in the areas that we liposuction and proportionately more in the areas that we grafted. I think the trick is to really, during the liposuction, and this is something I pay a lot of attention to, is really blending those areas out. I really don't like to draw a line and stop liposuctioning right where the line ends on the body, because if that patient does gain weight, then you will see that line sort of become a very strong transition point. And that's when people say, can you look really lumpy or weird after liposuction? The answer is yes, if you gain a lot of weight, if the liposuction wasn't blended into the surrounding areas. And I've seen that sometimes patients would come in and say, like, I went somewhere and I just asked for my flanks to be liposuction, and they marked me and they basically just took out a bunch of fat from this one specific area. And then I gained weight, and that area is thin, but I'm kind of balloony everywhere else. And it just looks really, really awkward. So that blending out those edges is really key. And that goes for fat grafting as well as for the liposuction.
Yeah, I remember in the early days of the laser skin resurfacing when they had in the early 90s, the CO2 laser, and the doctors didn't know at the time. They would do the face and like stop right along the jawline and then not feather it out into the neck. And it was exactly what you're talking about, because you could end up with this line of demarcation or something where it's like, oh, that's really awkward and strange. So that makes a lot of sense, but it takes longer, I'm sure, to kind of do that artistic blending.
Yeah, which is why a lot of times patients will ask for a specific area and I'll tell them about that. And it's, a lot of times my surgeries end up being like a 360 liposuction, because you really can't just address one area without addressing the other and have a nicely contoured, congruent result. It's not always the case. Obviously, it's not always necessary to do the entire trunk, but a lot of times it's a little bit more, it goes a little bit beyond what they think is the problem. You do have to blend out a little bit further just to get that nice transition.
Now men, and this, back in the day, in probably the 90s, I guess, was, you were talking about the pectoralis muscles and area. There were pec implants and calf implants. And tell me a little bit about kind of your philosophy on those kinds of implants. Do you use them? And if you don't, why not? Or where's kind of the industry on those implants?
I mean, I think they're still there. There's a lot of doctors that do put them in. I personally just think that they are a little bit of a risky thing. It is a foreign body that is inside. That is prone to all kinds of complications. It'll encapsulate, it'll scar in, it can get infected, it might have to come out. It can cause systemic problems potentially, as we're maybe trying to, sometimes finding out. So because of all of those things, I think that those are sort of the reasons that I avoid those. I think the fat grafting is a little bit safer in the sense that this is your own tissue. And it will make a little bit of a difference. Maybe not as a specific difference as a specific implant somewhere, but it will make a difference. And you're not fraught with the potential complications of having foreign body in that specific area, especially if it's an area that's moving a lot. I mean, that's the other one of the problems with implants in limbs, is that they can migrate a little bit as you're moving, for the athletic patients specifically. And when it migrates out of place, it starts looking really awkward really fast, because it's like, well, that muscle doesn't belong there. And so,
and those kind of implants are more thick, right? They're not
correct.
like a gel, right? They're like,
they're almost like plastic. Correct. Yes.
Yeah. Like an eraser in terms of like, it's bendable, but not liquid. Well, that's interesting, because I don't, I would think so personally, but, and I haven't seen a ton of them over the years. And I figure that's the reason, is that just sometimes you might want something and there's a better way to get there, or a safer way.
Let's just say I've removed my fair share of them for complications. And, there's patients that came in from elsewhere, and it's like, I don't like it. It's uncomfortable. It looks okay, but it's just, I feel it every time I move, this and that. And there's many reasons that people are just kind of opt against it after they tried it. And I think that may be the reason why they're not the first thing that we think of when we want to augment.
Now, another area, the last area I think that we have to talk about, unless you think of something else. But I was thinking, women and men alike, we all get, and I think men especially, tend to get that heaviness around the neck and the jowls. And we talked about, some ways. Is liposuction a good, I know they can do some cool sculpting there. Is liposuction something that you find does the trick to help eliminate that heaviness?
Yeah, so every patient is different, and we have to examine them. But yeah, definitely there are a lot of patients who are candidates for liposuction alone of that area. I just literally did it right before I came up here.
Oh, really?
Yeah. But it's a patient that doesn't have a lot of redundant skin. It's typically somebody that's a little bit younger, but they always had this extra volume that kind of never goes away. And if you feel that, and if the muscles are in good place, and if they're really high, and that the excess is really just fat, that's a great candidate to go ahead and just liposuction that area, and it can really help their jawline and help their profile.
Yeah. I remember
Definitely.
a patient a long time ago did that, and it was really pretty hereditary because they were young and like late 20s, maybe early 30s, but it was sort of a hereditary thing. And they wanted it done before their wedding. And I was like, genius, and it was not a really huge procedure. Is that something that's kind of a quick healing time procedure?
And that's actually, you described the perfect candidate for that, because this is a younger patient whose skin will retract really, really well, but they're just born with this. The downtime is pretty minimal, especially if that's the only intervention. The incisions are not even incisions. I use a 14 gauge needle, which is basically a big needle to get access points. And there's just 3 little holes that I poke through the skin underneath the chin and under both ears. And that's enough to get the cannula inside to do all the work. So when it heals, it's almost like, the equivalent of when you get your blood drawn through your arm. It's basically scarless.
Wow.
So it's pretty effective. And we can get all that fat out and really contour that line and make a kind of a lifetime difference for that patient.
Right. That's a huge thing. And I think any of us who have extra skin and fat under that area is like, what can we do to camouflage? So I think for guys, I think that's a great one. Mm-hmm. Well, have any do you have any like thoughts that we haven't crossed in terms of sort of some of the typical man procedures?
Not really. I think the only other one that we haven't talked about yet is of patients who have gained a lot of weight. Liposuction is never a weight loss procedure. So some of those patients need bariatric surgery. I think right now medications like Ozempic are getting a lot of interest. So I think we're going to see more and more of patients who have been a little bit heavier and then who have lost a significant amount of weight. And those patients tend to need skin resection procedures. So like a tummy tuck, women get those all the time because they carry the pregnancy unfairly. But they, after a pregnancy, the skin grows in response to the volume of that pregnancy. And when the pregnancy goes away, the skin does not retract to the same extent. Sometimes it retracts pretty favorably, but sometimes it just kind of overhangs. And really the best way to treat it is remove the extra skin that has grown. And that's what a tummy tuck is. Men who have gained a lot of weight and then lost it present themselves in that similar light. And they also benefit from, tummy tucks, sometimes arm skin removal procedures like arm lifts or thigh lifts, things like that. So all those are also options for men as well.
Oh, that's good to know. And I just thought of this, and this isn't your specialty, and I won't put you on the spot about it, but we need to do an episode. We do the P shot. So there's an O shot for women to help with orgasm. There's a P shot for men, and we have that available in our med spa. So we're going to do a separate episode about sort of sexual health type things. But if that piques anybody's interest in the audience, we'll put the link in the website so you can read about it. But it's a no downtime sort of situation. And it also uses what we talked about earlier, the PRP, the platelet-rich plasma. So thanks, Dr. Swistun, for coming on our dad's episode and being so honest about what you've done and, sharing with all of us sort of what are the things that, men can do to still feel really good. And even as you age, you can age in a way that you feel healthy and confident. So
yeah, I think that's the biggest underlying thing is that we don't have to sort of give in to the aging process. There are things we can do to kind of maintain a certain age level, at least for a little bit.
Yeah.
A little bit longer.
Yeah, exactly. Well, you're doing whatever you're doing. It's working because I wouldn't have thought you were 47. So congratulations on that. We keep it up.
Thank you.
We'll get you penciled in for your next treatment.
Yes, need that.
Yeah. Thanks, everybody. And happy Father's Day to all the dads out there.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.